Welcome to the Huntsman Mental Health Institute Neurobehavior Home Program Feeding Clinic. Here at our clinic, we provide an interdisciplinary approach to the assessment and treatment of children, adolescents, and adults with feeding and swallowing difficulties. Our team consists of licensed psychologists, behavior specialists, registered dietitians, and speech-language pathologists who work together collaboratively to support the feeding needs of our clients and their families. Let's meet some of the feeding clinic staff. I'm Dr. Aaron Fisher. I'm the feeding clinic director, and I'm a licensed psychologist and board-certified behavior analyst. I oversee clinical services and facilitate partnerships across the community and in schools. Heather Lewis is the feeding clinic assistant director and board-certified behavior analyst. She's responsible for providing supervision to clinicians and conducting behavioral assessments for initial evaluations. Mark Cantor is the clinic's speech and language pathologist, and he conducts the swallowing and chewing assessments for initial evaluations. He is frequently accompanied by speech and language pathology students who are in training. Sydney Abbott is the clinic's registered dietitian. She evaluates the nutritional aspects of the client's diet to provide dietary recommendations during initial evaluations. Additionally, we have a team of several clinicians who are graduate students at the University of Utah in the school psychology program. They are responsible for providing direct services to clients and their families. We are a partnership between the University of Utah's Technology and Training, Education, and Consultation Lab and the Huntsman Mental Health Institute Neurobehavior Home Program. At the initial evaluation, our interdisciplinary team will meet with the client and caregivers to discuss current concerns, feeding history, and previous intervention services. Afterwards, they will work to coordinate a treatment plan that is individualized for the client's unique needs. Our clinicians will provide families and caregivers with the training and support needed to bring treatment interventions into the home and community to ensure that growth is maintained. These sessions can be delivered virtually or in person, typically across 8 to 12 sessions, depending on family need. The goal of the feeding clinic is to address any adverse experiences related to feeding that families and individuals may be experiencing. For example, we treat the following difficulties: food refusal, fear or anxiety related to feeding, picky eating or food selectivity, behavior problems related to feeding, oral motor and sensory problems, chewing difficulty, feeding tube dependence, and any difficulties related to the risk of aspiration, coughing, choking, or gagging. The feeding clinic team looks forward to working with you, whether virtually or in person. If you have any questions about the feeding clinic, including the team and services available, please reach out to me, Dr. Fisher, through email at UTTECundrscore FEEDING@hsc.utah.edu or by phone at 801-587-1842.